Dear friends, today I am going to explain exactly what happens when stool gets stuck in the rectum. Doctors call this fecal impaction a severe form of constipation. So let's start. What's actually happening? Think of your rectum like the final stop before a bowel movement. Normally, stool arrives, your body sends a signal that it's time to go and everything moves out smoothly. But when stool sits there too long, it starts losing water. The longer it stays, the harder and drier it becomes. Eventually, it can feel like a large, hard mass that's difficult or even impossible to pass. At that point, pushing harder often doesn't solve the problem. In fact, excessive straining can sometimes make things worse. Stool stuck in the rectum causes. The most common cause is fecal impaction, a large hard mass of stool that's too difficult to pass. This often happens after days of constipation. Besides, other possible causes include not drinking enough water, a low fiber diet, ignoring the urge to have a bowel movement, certain medications like opioid painkillers or some antidepressants, weak pelvic floor muscles, or difficulty coordinating the muscles needed for a bowel movement. Less commonly, a blockage or narrowing in the colon or rectum. Common warning signs. Here are the some signs stool may be stuck in the rectum. Constipation, a sensation of blockage, staining with little or no results, rectal pressure or discomfort, abdominal bloating, small amounts of liquid stool leaking around a blockage, and some people think they have diarrhea when they are actually severely constipated because liquid stool is squeezing around the impacted stool. Biggest mistakes people make. 1. Ignoring the urge to go. The longer stool stays in the colon, the more water gets absorbed out of it. 2. Pushing harder and harder. Excessive straining can increase pressure and may lead to hemorrhoids or other complications. 3. Not drinking enough fluids. Your body needs water to help keep stool softer and easier to pass. 4. Depending on quick fixes without addressing the underlying cause. Now we will discuss the diagnosis. To diagnose stool stuck in the rectum, your doctor may ask about your symptoms, check your medical history, perform a quick rectal exam, order an X-ray or CT scan if needed. Besides, your doctor may order a blood test only if another problem is suspected. What can help? If you're dealing with mild constipation, several things may help. Drink adequate fluids throughout the day. Increase dietary fiber gradually through foods like fruits, vegetables, and whole grains. Stay physically active. Sometimes even a short walk can help stimulate bowel activity. Using a footstool under your feet while sitting on the toilet may also help create a more natural position for bowel movements. However, if stool is severely impacted, home remedies may not be enough. That's when medical treatment becomes important. Your doctor may recommend the following treatment options: polyethylene glycol, Miralax to soften stool, docusate sodium cholase as a stool softener, bisacodyl dulclax or a glycerin suppository to help empty the rectum, mineral oil or warm water enema if stool is severely impacted. If these don't work, your doctor may perform manual disinfection to remove the stool safely. When to see a doctor immediately? If you observe severe abdominal pain, vomiting, blood in the stool, inability to pass stool for an extended period despite strong urges, significant swelling of the abdomen, and fever, consult with your doctor immediately. If you found this video helpful, hit that like button, subscribe for more health and wellness content, and let us know in comments what health topic you'd like us to cover next. Thanks for watching, and we'll see you in the next video.